Hello everyone, I am Mary Rose Bibendanilio from Norso Campus, taking up Bachelor of Secondary Education, major in English.
Today, we will be discussing about the Unit 3 Typology of Learners with Special Needs and my assigned topic, which is under the E Learners with Socio-Emotional Disorder, which are the emotional behavioral disorder, anxiety attack, and depression. We define first what is socio-emotional disorder. So, socio-emotional disorder are mental health conditions that impact a person's thoughts, emotions, behaviors, and ability to interact with others. The disability may be temporary or permanent. The specific condition can affect a child or young person in various ways, and these impacts may manifest at different frequencies throughout their school experience. So,
Socio-emotional disorders refer to mental health condition affecting an individual's thoughts, emotions, behaviors, and interpersonal interactions. These disorders can disrupt normal social and emotional functioning, making it challenging for individuals to navigate relationships and daily life. Socio-emotional disorders can affect kids or young people in different ways, showing up at the various times during their school years. These impacts might happen more or less often, influencing how they handle emotions, behaviors, and relationships while in school. Learners with socio-emotional disorders struggle with handling their emotions, forming positive connections with others, and making responsible life decisions. These challenges can impact their overall well-being and ability to navigate daily situations effectively.
there are five types of learners with socio-emotional disorder, which are emotional behavioral disorder, anxiety attack, depression, obsessive compulsive disorder, and bipolar disorder. But I will discuss the only three types of learners with socio-emotional disorder, which are emotional behavioral disorder, anxiety attack, and depression. So let's move on to what is emotional behavioral disorder. An emotional behavioral disorder affects a person's ability to be happy, control their emotions, and pay attention in school.
An emotional behavioral disorder can hinder a person's ability to experience happiness, regulate their emotions, and stay focused in school. This difficulty managing emotions and attention curve can have a significant impact on their overall well-being and academic performance.
Learners with EBD or emotional behavioral disorder exhibit one or more of the following characteristics: inability to learn, inability to build or maintain satisfactory relationship, inappropriate behavior or feelings, and etc. Students diagnosed with EBD may be included in general education classrooms, but severe cases may require special education, cluster units, self-contained programs, or separate schools. It is important to address both the emotional and academic needs of students with EBD and to provide support in the least restrictive environment possible.
Students diagnosed with emotional behavioral disorders might be included in regular classrooms, but in more severe cases, they may be benefit from special education settings like cluster units, self-contained programs, or separate schools. These environments provide additional support tailored to their specific needs. Addressing both the emotional and academic needs of students with emotional behavioral disorders is crucial. Striking a balance is important to ensure comprehensive support considering the unique challenges they face. It's also essential to provide this support in the least restrictive environment possible, aiming to promote inclusion and allow these students to participate as fully as possible in regular educational settings while receiving necessary assistance.
Next is what is anxiety attack. An anxiety attack usually involves a fear of some specific occurrence or problem that could happen. Anxiety is a normal emotion, but when it interferes with daily life, it may be a serious mental health condition that requires treatment.
During an anxiety attack, individuals often experience intense fear related to a specific event or problem that they believe might happen. This heightened anxiety can lead to various physical and emotional symptoms such as rapid heartbeat, shortness of breath, and sense of impending danger. Treatment. You may have feelings of impending doom, shortness of breath, chest pain, or a rapid, fluttering or pounding heart, or heart palpitations.
Anxious students may express their fears by crying or throwing tantrums. It may be very difficult for them to calm down. Some students may seek constant approval or reassurance from others. Students may describe feeling physical symptoms like headaches, stomach aches, racing heartbeat, or difficulty breathing. Anxiety may make a student appear to be cautious, nervous, shy, or fearful.
Certain students dealing with anxiety may constantly seek approval or reassurance from others. They might also express their anxiety through physical symptoms such as headaches, stomach aches, a rapid heartbeat, or difficulty breathing. These manifesting highlight the diverse ways anxiety can impact individuals both emotionally and physically.
Treatment options for anxiety disorders include therapy, medication, and self-care strategies such as relaxation techniques and exercise. Then last is what is depression? Depression or major depressive disorder is a common and serious medical illness that negatively affects emotions, thoughts, and actions. Depression is a common occurrence among students of all ages, whether you're in high school, college, or grad school.
Depression or major depressive disorder is a prevalent and serious medical condition that has a profound impact on a person's emotions, thoughts, and actions. It goes beyond normal feelings of sadness and can lead to persistent feelings of hopelessness, low energy, and changes in behavior. Seeking professional help is important for diagnosis and appropriate management of depression. Depression is a widespread experience among students across various educational levels, including high school, college, and graduate school. The challenges and pressures associated with academic life combined with other personal and social factors contribute to the prevalence of depression in students' populations. Recognizing the signs and seeking support is crucial for addressing health concerns during these formative years. It, Depression isn't just limited to college students, though it can first start in elementary school, middle school, or high school.
Symptoms can include feeling sad, loss of interest in activities, changes in appetite, trouble sleeping, loss of energy, feelings of worthlessness or guilt, difficulty thinking and concentrating, and thoughts of death or suicide. Causes of depression are a complex interaction of social, psychological, and biological factors, and those who have gone through adverse life events are more likely to develop depression.
Depression symptoms encompass a range of experiences such as persistent sadness, diminished interest in activities, fluctuations in appetite, sleep disturbances, low energy levels, feelings of worthlessness or guilt, challenges in thinking and concentration, and in severe cases, threats of death or suicide. Recognizing these signs is essential for early intervention and seeking appropriate professional help.
Prevention programs such as school-based programs, intervention for parents, and exercise programs for older persons have been shown to reduce depression. Treatment options include therapy such as cognitive behavioral therapy or talk therapy and medication such as antidepressants. Treatment plans are individualized to the patient's needs and preferences. That's the end of my discussion. Thank you for watching and listening.